In this video, we will show you cervical joint position sense exercises to treat patients with cervicogenic dizziness.
Enroll in our online course now. Link is in the video description.
Hi and welcome back to Physiotutors. Deficits in cervical joint position sense, eye movement control and postural stability are often noted in patients with traumatic neck pain and cervicogenic dizziness due to abnormal afferent input. A tailored sensory motor control program based on the individual deficits has been designed by Treleaven et al. In the year 2008. In part 1 of this video series, we will focus on cervical joint position sense exercises. The patient practices relocating the head back to the natural head posture and to predetermined positions in range from the movement directions assessed to be abnormal during joint position sense testing. So if the joint position sense error was greater than 4.5 degrees when returning to neutral from rotation to the left, you would want to practice this movement. Like in position sense error testing, have the patient sit 90 centimeters away from the target, wearing a laser tracker pointing at the target. First, the patient may practice rotation to the left and returning to neutral with the eyes open. To progress, the patient is asked to do the same exercise with the eyes closed. Higher level skills training could include tracing intricate patterns. We have a training pattern here that we would like to show you, but you can also draw a pattern on the wall, for example. A first exercise could be to move around the outer square in a clockwise manner. The patient starts in the upper left corner and moves from dot to dot, stopping in each dot. Afterwards, you can reverse the direction. To make it more difficult, you can switch to the diamond pattern, for example, which includes diagonal movements. Progression of each exercise can also be achieved by increasing the speed, number of repetitions, or by changing the base of support. So you could have your patient perform the exercise in standing, tandem stance or single leg stance, on the floor, or even more difficult on a foam mat. To further progress, we can use the following pattern from trackerlaser.com. Thanks a lot for supplying us at this point. With this pattern, you can train cervical tracing. Have the patient start with the laser directly in the middle and practice tracing a horizontal line as quickly and smoothly as possible without deviating from the line. The same exercise can be done for vertical tracing. The most difficult tracing exercise is to move on the diagonal lines. Progression of each exercise can also be achieved by increasing the speed, number of repetitions, or by changing the base of support. So you could have your patient perform the exercise in standing, tandem stance, or single leg stance on the floor, or even more difficult, on a foam mat. Treleman et al. In the year 2010 suggest to perform these exercises 2 to 5 times per day. Temporary reproduction of dizziness is acceptable. However, exacerbation of neck pain, headache or dizziness is not acceptable. If this occurs, the exercises should be modified by decreasing the number of repetitions. Alright, this was our video on cervical joint position sense exercises for cervicogenic dizziness. If you are curious about other management options for cervicogenic dizziness, check out the video right next to me. A lot of this information and much more can be found on our future course on the spine on our website study.physiotutors.com. Of course, we'll be happy if you leave a like and follow our channel. This was Kai for Physiotutors. Thanks a lot for watching. Bye.